Hi doctors, now focus 30, third day. So 2 days over and third day, and today we are going to discuss something very important. Okay, sexually transmitted diseases and that kit and some congenital infections and spotters. You can see here some images. What is this image? Anybody can tell? What is this? And here, what is this? This any idea? It's a spotter. And here, arrow is there. Any idea? Okay, so we are discussing sexually transmitted diseases. So in a brief way, and there is a compulsory rule that every year there will be question from STD, especially 2 or 3 questions will come from that area. Okay, 2 or 3 questions will come from that area. So before that, I will be adding the link of WhatsApp group so that you can join and we can discuss few things. And this video, when I am uploading in YouTube, sometimes the font is coming little blur, so watch it in high quality 720p or high qualities. Okay, so now we will discuss about this topic. Okay, just 30 minutes. So sexually transmitted diseases. So before that, I am discussing about urethritis. So we have gonococcal urethritis and non-gonococcal urethritis, that is NGU. NGU are mainly by chlamydia trachomatis D2K, ureaplasma ureolyticum, mycoplasma and trichomonas vaginalis. These are causes of NGU. They may ask simple question and they may put Neisseria gonorrhea there and we have to eliminate it out. Okay, so we know gonococcal urethritis mainly caused by Neisseria gonorrhea. Okay, so what are the clinical features in this? Here in gonococcal urethritis, profuse and purulent discharge will be there. Profuse and purulent discharge will be there. Okay, and this is because of the gram-negative intracellular diplococci. This is the diplococci. Okay, cocci bacteria. Okay, so management is ceftriaxone, whatever. So here profuse and purulent discharge and diplococci in the image. Okay. Okay, what is NGU? Non-gonococcal urethritis. There are many examples I told. Okay, here scanty and mucoid discharge. Scanty, very little, and mucoid discharge will be there. Okay, okay, and numerous polymorph nucleus we can neutrophils we can see, and absence of the diplococci. Okay, so here management is azithromycin. So gonococcal urethritis and non-gonococcal urethritis, NGU, which is important. Okay, now we are going to the next topic. Highly important. What is anogenital warts or Condyloma acuminata? Okay, so you can see a image like a cauliflower. Okay, cauliflower. So cauliflower like lesions, and you can see something in this image. So this image is the direct answer to the question. Maybe there is a histopathological image will come, or that clinical like cauliflower like lesion. So these terms are there. We can go to anogenital wart or Condyloma acuminata. What is this? These are nothing but there is a cell and nuclei in the side. These are called coilocytes. Okay, these are very important. So these are caused by HPV, and mainly the lower is 6 and 11 and higher is 16 and 18. So you know HPV virus have 6 and 11 strains and 16 and 18 strains are there. These 6 and 11 strains are low risk and 90% of the infection by this only. And HPV 16 and 18 are high risk and 10% of the infection is because of this high risk HPV. So this strain also very important. So cauliflower like lesions and coilocytes. See the coilocytes. Okay, very important. You can see the coilocytes here. Okay, clear. Okay. Now we are going to discuss something together, and finally we will summarize the terms and the questions. Okay, so now we are going to discuss something like chancroid. What is chancroid? Chancroid is caused by Haemophilus ducreyi. So this is a revision video, very important discussion session. So I am not going in detail. So chancroid is caused by Haemophilus ducreyi. So we can see in the gram-negative coccobacillus. This is a coccobacillus. So this is a coccobacillus. So we can see the gram-negative coccobacillus in a railroad track appearance. You can see here. If you see this image, this spotter, that is because of Haemophilus ducreyi. And what are the clinical features? Multiple deep pulses. You can see here multiple deep pulses. multiple indurated deep ulcers. Okay, and there are yellow exudate, gray to yellow exudates, and organism is like you can see a school of fish appearance, pool of fish appearance, and railroad track appearance. You can see the spotters. So this image and this image is giving chancroid caused by Haemophilus ducreyi. Okay, chancroid or chancroid, whatever. And next very important and simple topic is herpes simplex virus, HSV, herpes simplex virus 1 and 2. So you know herpes simplex, multiple small grouped ulcers. This is a multiple small grouped ulcers. The term will be there. It is very easy to understand. And whatever we have multinucleated Jan cells or Jan cells will be there. These are the sang smear. You can see the multinucleated giant cells. Okay, and you can see grouped vesicles and grouped multiple small grouped ulcers. You can see, and this is the ulcer, and these are the vesicles. So vesicles, multiple grouped ulcers, Zang smear, multinucleated giant cells are giving into HSV 1 and 2, herpes simplex 1 and 2. Okay, clear. And here there is a question. Initial lesion is painful. So here the lesion is painful. So both chancroid and HSV, the lesion initially painful. So painful lesions, painful. Tenderness will be the painful lesions. Clear? So chancroid and HSV painful. Okay. Now we are going to some other part. So now we are going to see some bacterial vaginosis, trichomonas, and candida. So mainly vaginal discharges. Okay. Now the picture I kept in the front. What is this? This is known as strawberry. Strawberry cervix. Correct only, no? Okay. So what is this? This is some white thick cottage cheese discharge. Okay, this you can see the clue cells. So all these three are differentiating feature of all these three. Okay, now what is bacterial vaginosis? So bacterial vaginosis, here there is no inflammation as such, and there is something called clue cells. Clue cells are the classical identification point of bacterial vaginosis, clue cells. Okay, and there is some fishy odor smell is coming, so positive whiff test will be there, and this is a parasite. So metronidazole is the management. So bacterial vaginosis. So bacterial vaginosis, this is not a parasite, it's a bacteria. Okay, there is some pathology. There is lactobacillus will be rich. How the lactobacillus is produced, when this acidic changes happen, how this pathological bacteria grows. Like that, there is a pathology. We are not going into in detail. So bacterial vaginosis, clue cells. You can see clue cell. These are the normal vaginal cells. You can see the normal vaginal cells. You can see here normal vaginal cells, and lactobacillus are rich in these are the small lactobacillus. See these clue cells, so numerous. Gardnerella vaginalis. These are the causative organism. So they are rich, and these are known as clue cells. It's a classical of bacterial vaginosis. And here there is something called Nugent score and aim cell criteria. Nugent score and aim cell criteria can be there in bacterial vaginosis. Now we come to some other topic of similar disease progression, trichomonas infections. So this trichomonas infection, which will cause a yellow green and frothy discharge. Okay, you can see here, you can see some yellowish green frothy discharge. So sign of trichomoniasis or trichomonas infection. Okay, so that is a parasite. Okay, that is a parasite. So that is also important. And now candida is a fungal infection. See, you can see the thick cottage cheese discharge. Okay, so there is vaginal inflammation in both trichomonas and candida. There is no vaginal inflammation in bacterial vaginosis. This is very important. Okay, so we can see pseudohyphase because of fungus. Okay, and fluconazole is the management. So this is very important, and the differentiating features also very important. Bacterial vaginosis, clue cells are. You can see the diagram. Clue cells will be the directly. It is the clue for the answer. So clue cells are the clue for bacterial vaginosis. Okay, trichomonas. You can see the greenish strawberry vagina, whatever we can see like this. See, reddish strawberry type, and frothy greenish yellow discharges. Okay, classical. And cottage cheese, candida. Okay, clear. Now we are going to the next. Now this is little tricky, but this is very important. At the summary, you will understand better. So we are now going to discuss three other diseases. One is Granuloma inguinale, syphilis, and lymphogranuloma venerum, LGV. Okay. So Granuloma inguinale caused by Klebsiella granulomatis. So Klebsiella granulomatis causes Granuloma inguinale. So this is a extensive and progressive ulcerative lesion. This is an ulcerative lesion without lymphadenopathy. There is no lymphadenopathy. We can say there is no lymphadenopathy. Okay, we have granulation tissue, granulomatis, granuloma inguinale. Granulation tissues are there in the base. Okay, and we can see some gram-negative intracytoplasmic cyst known as Donovan bodies are there. Donovan bodies are a features of granuloma inguinale. There is no lymphadenopathy as such. Clear? Syphilis, everyone know what is syphilis and how we have to approach syphilis. Syphilis is caused by the Trypanosoma pallidum. Okay, pallidum. Okay, we know corkscrew motility of the Trypanosoma pallidum. Okay, dark field microscopy to identify, because Trypanosoma, this species has to be separately studied, and this is very significant. Okay, so this is a single indurated, well circumscribed ulcer. So single indurated, well circumscribed ulcer. That means we will see the diagram. Okay, after seeing diagram, we'll come back to this theory page and we'll see it again. Okay, okay. So last is LGV, lymphogranuloma venerum, caused by Chlamydia trachomatis. Chlamydia are different. Okay, Chlamydia L1 to L3, L1, L2, L3 is causing LGV, L1, L2, L3, LGV. So these are small shallow ulcers, and these are large, painful, and lymph nodes or buboes are present. Lymph nodes, here it is known as buboes, are present. Okay, and we have chlamydial inclusion bodies are present in this. Okay, so this, now you go and see the images. Now we will come and see. See, syphilis, that ulcer is known as Hydrocephalus. This is a single clean based indurated non-tender, it's not painful and not bleed on touch. Syphilis, non-tender, no bleed on touch. Okay, known as Hydrocephalus. So the name is Hydrocephalus, but it is very soft, like non-tender, not bleed on touch. Okay, just understand like that. And inguinal lymph nodes, bilateral, enlarged and non-tender, rubbery lymph nodes. Here, this is a painless condition. Okay, we'll see. Now you can see something called, these are inguinal buboes. Okay, inguinal buboes, that is seen in LGV. Okay, now you see this is a classical described lesion. Okay, this is a classical described lesion. You see the appearance. Okay, this is of granuloma inguinale, beefy appearance. Beefy, some word will come like this. Okay, so that is a classical of granuloma inguinale, which is caused by the Klebsiella granulomatis. There is granulation tissue formed. Okay, like that. All these three conditions, initial lesion are painful? No. These are painless condition? No. Initial lesions are painless. Maybe later pain may appear in because of some reasons. Okay, but here initial lesions are painless here. Okay, and no lymphadenopathy in granuloma inguinale. Syphilis is, it is Hydrocephalus is the name, but it is like we are discussed here. It is like single clean, non-tender and not bleed on touch. Okay, these are the buboes, inguinal buboes. These are large, painful. Okay, later pains is developed, but initial lesions are painless. Okay, this is little confusing, but very, very important, and later we will solve this. Okay, okay. Now we are going to the other part. So summary. First of all, in question may there is painful genital ulcer, painless genital ulcer. So painful genital ulcers, Haemophilus ducreyi, that is soft sore or chancroids, and genital herpes symbols 1 and 2. So we are discussed here. Okay, we are discussed here Chancroid and HSV, painful condition, and painless condition. We can see painless condition, Trypanosoma pallidum, syphilis, Chlamydia trachomatis, LGV, and Granuloma inguinale by Klebsiella granulomatis. These are painless condition. Clear? Clear. Okay. So painful are Chancroid and genital herpes. Clear? Other three are painless. Now we'll go to the history clincher and we'll go and find the diagnosis. Okay, painful, clustered. So cluster, so many herpes simplex. Okay, erythematous lesion. This is painful. No, we know herpes infections are painful and clusters are there. Definitely HSV. So it is grouped vesicles or ulcers. Clear? Okay. Next, painful. Painful mean chancroid or herpes simplex. Undermined, deep, matted lymph nodes. So chancroid or chancroid, whatever. Okay, I'm not good in English. You maybe saw my videos before also. My grammar, my talking, especially I am a Malayali and my Mallu accent will come. So I'm not good in language, but I'm good in telling important things to people. So please don't judge me by basics of my language and talking skills. Okay, and please understand any corrections or something is a please comment or message me personally also. Thank you. So next painless. So now we are going to painless. Red beefy ulcer. See, red beefy ulcer. No lymph node. It's granuloma inguinale. Clear? Klebsiella granulomatis causing granuloma inguinale. Granulation tissue is there, looking like a red beefy ulcer. Clear? Very important. Please, this only single side is enough to get a good score in NEET. And next, painless indurated ulcer. Painless lymph node. So indurated, painless, single, neat. Okay, syphilis, hard chancre. Okay, not bleed on touch, no non-tender. Clear. And last, painless large flexion lymph node swelling with sinuses. So this is an example of lymphogranuloma venerum, where we can see the buboes. There will be sinuses also in that. Okay, so this is the way of clearing the topic. So these points will help. So at least study these points and the painful genital and painless ulcers. So from the term we can go to the answer. And don't, whenever the question come from STD, options will be there: chancroid, syphilis. Don't go and blindly put answers, click answer and go forward. Just read, see the clincher word, understand why they will trap you. The examiners know how students will study and they will easily trap you. If I am an examiner, I will I can put tricky questions. So you will feel like, oh, simple question, STD, chancroid. But you may be wrong. So just read, understand the keywords, just see the option, then answer. Okay. So now we are going to the kits of STD. Okay. So STD we are discussed in a simple way, and there is so much theory. We know gonococcal urethritis, non-gonococcal urethritis. Why I am stressing is, again, this is a sure short question. 2 questions will definitely come for this NEET PG exam. 2 questions sure. Maybe if you are lucky, 3 will come. So gonococcal urethritis, non-gonococcal urethritis. What are the causes and why? How to differentiate? Important, simple. And anogenital warts and why? Coilocyte, cauliflower shape. Okay, then we are going to Chancroid and HSV. These are painful. Chancroid and HSV, grouped vesicles or ulcers, and Chancroid, gram-negative coccobacilli, that appearance. Okay, and indurated ulcers, multiple deep ulcers will be there. Okay. Now some vagina, strawberry cervix, and clue cells and cottage is appearance, and Nugent score, AMCEL criteria for bacterial vaginosis. Okay, AMCEL criteria. This is a little important. Okay, I'll share the PPT in my personal channel. I'm giving the link also. Please do follow. Come back to my WhatsApp channel. I am limiting number of students. Whoever coming early, I'll be checking and I am putting them in the group. I will be sending so many tips and tricks. However, it is useful or not, I don't know. Maximum, as a backbencher or last time student, I know the difficulty of student. So I am putting last 30 days the strategies to develop or improve your score, final score. Okay. Finally, that final rank will matters. All others efforts, whatever you put, it doesn't matter. The final rank will matter, and the branch you selected will matter. So later on, your life is going to determine by the coming 30 days. Okay. So put maximum effort, and sometime if you are lucky, with a little effort, ranks will come better. But if with because of some reasons, like exam day tension, exam day fever, so many things. It will happen to students. Whatever you are feeling, this is a phase of life. You have to, you will cross it, and you will have beautiful life ahead. Okay, there is no one to judge you, no subject to decide you, no branch to decide your life. You are the person, you are going to decide yourself. Okay, so we are going today. So much motivation is coming, I don't know, but this is 30-day remaining from today. That's why please be consistent, steady the high yield topics, will go forward. Okay. So now this also we discussed granuloma inguinale, syphilis very simple, name is Hardshanger but it is very soft, and LGV, chlamydia species, very important, buboes are there, sinuses are there, like that. Okay, see the diagram, see the PPT, see this video 1 or 2 times of this topic, you will understand. Okay. This is the summary, this is very important, please go through this, take the screenshot and keep it with you and see, stick it in the 20th notebook. Okay, so please go to the 20th notebook, this should go to the 20th notebook. Okay, now we are going to the other topic. Okay, so STD over, now STD kit, the syndromic management. So you see, there are, see, 1, 2, 3, 4, 5, 6, 7 colors. It is like a rainbow, 7 colors. See, this is very important. The first one, see, first one, it's gray color, and it is urethritis or cervicitis, very important. Gray color, urethritis or cervicitis. So RE, gray, RE. So GRE, cervicitis. Okay, whatever. ER. Okay. So this gray, cray, whatever. That similar name. Cervicitis, urethritis, gray. GRE. It's repeating RE. Okay, gray color. So that is cervicitis or urethritis, gray color. So clear? Okay. So it is little difficult. This cervicitis or urethritis caused by gonococci or chlamydia, we have discussed before. So management will be cefixime or azithromycin. They usually doesn't ask the management, they simply ask the color code and the indication, like cervicitis. So 2024 NEET, they trapped us with urethritis, cervicitis. Okay. Now green, second one is green, gray, green, second. So green vegetables are safe. So green vegetable, vaginosis. So green is vaginosis, vaginal discharge. Green is vaginal discharge. Green so green vegetables are safe. SF. S for secnidazole, F for fluconazole. So green vegetables are safe. Second one is green, which is vaginal discharge, secnidazole and fluconazole. Clear? Symbol. So bacterial vaginosis, candidiasis, trichomoniasis, the second box we studied before, it is coming here. Okay, clear. Third is white is, so now 3, 4 and 5 we can classify into herpetic type. So here we have genital ulcer disease. Okay, GUD, non-herpetic and herpetic. Herpetic ulcer is there, non-herpetic ulcer is there. Herpetic ulcer means the management, the diagnosis is genital herpes and management is acyclovir, antiviral. Clear? And non-herpetic we have divided into two, white and blue. So white, so it is mainly syphilis, chancroid. Syphilis है तो benzathine penicillin, very important. And there is a reaction in syphilis which will just comment on the reaction related to syphilis. And there is congenital syphilis, there is a low, it's low. Please comment on that, what is that? This and all you should know. What is Kisowitz law? What is Jarry-Sextimer reaction? These are very important. Okay. So azithromycin for chancroid. So white, non-herpetic, blue, non-herpetic. So who are allergic to penicillin is coming into blue. So gray, green, white, blue. White and blue are GUD with non-herpetic. Those who are sensitive, they will be in third group, white. And those who are allergic, we are coming in the fourth group. Clear? Red. So she is very good in red. She is good in red. Her. She mean her is good in red. She is good in red. So she is good in red. So she is good in red. Herpetic, good. The genital ulcer disease and red. Symbol, fifth one. So genital herpes acyclovir. And yellow, what is yellow? Yellow, low. So lower abdomen pain, yellow symbol. So it can be because of gonococci, chlamydia, anaerobis. So the treatment. So below umbilical level, the management of infection is mainly by metronidazole. Above will be cephalosporin, usually cefixime, whatever. I'm not going to tell in detail. Just I'm for a clarification. I'm telling just to understand. So just remember cefixime for gonococci and chlamydia, doxycycline, very important, doxycycline, and metronidazole anaerobes. Okay, anaerobes below we'll go for metronidazole. So like that, you just imagine like that and write like that. Okay, yellow, low abdomen pain. Okay, and crow is black. Crow, scrotal swellings. Crow is black, which is 7, which is inguinal buboes. Inguinal buboes are scrotal swellings, that is black. Okay, so we have azithromycin and doxy for that. So now you come and see this color, which is very important. Gray, gray, urethritis, cervicitis, clear. And gray, green vegetables are safe. Green veg, vaginosis, vaginal discharge, safe. Secnidazole and fluconazole, very important. Okay. Now white, blue, red, all are GUD, genital ulcer diseases. Non-herpetic and herpetic. Herpetic, hair is good in red. She is good in red. Hair, herpetic, GUD, red. So she is good in red. Hair good in red. Herpetic, red, clear. Okay, genital herpes. And white and blue is allergic and white is non-allergic. So penicillin can be used. Okay, clear. And yellow, low. The sixth is yellow, lower abdominal pain. And black, scrotal swellings, inguinal buboes are scrotal swellings. Crow is black. Okay, this is the mnemonic and this is the way to study. I don't know how much better way to study. Almost maximum things are I covered, and you can see you can make your own mnemonics, and there will be additional mnemonic. But imagine you are studying so many mnemonic. To learn that mnemonic, you have to keep again a mnemonic. So better to, whenever there are 7 things are there, keep 3-4 mnemonic to remember. Other one you can eliminate out. So hair good in red is not there. That is herpes out. And green, vaginosis, vaginal discharge. Like that you put. For example, black, inguinal, lower abdominal pain. So like that you imagine and rule out. Okay. Now we are going, so sexually transmitted diseases and it is very important topic, that is just over now. Okay. Now torch, and now I am putting some light into your life with torch. So what are the torch infections? Now we are going to a topic where congenital infections are discussed. Okay. What are the torch infections? See, toxoplasma, O for others, R for rubella virus, C for cytomegalovirus, H for herpes simplex virus. The others are, we have mainly syphilis, Treponema pallidum, that is syphilis, and varicella zoster, parvovirus, B19 and HIV, whatever many are there. So toxoplasma gondii and rubella, cytomegalovirus, herpes simplex and others, Treponema pallidum, syphilis mainly, and varicella zoster, parvovirus, B19, etc. Okay. So these torch infections, mother to baby spread. So fetus through the placenta, it is spreading to the fetus. So that is very important. That's why congenital infection I made separately. And there is highly expected one question for this year. Please watch. So now we are going to discuss that. The first one, congenital varicella. So you can see the varicella. What are the features? Varicella, zoster varicella. Maybe many have suffered from that. So this intrauterine infection during pregnancy, so they have some cortical atrophy happen, microcephaly is the classical feature, and limb hypoplasia, sometimes limb hypoplasia, and cicatrical scars on the skin. Okay, this is an example of varicella. So some varicella ka image they will keep and they will give some microcephaly. They will ask, so question mein microcephaly will be there, macro will be there. So don't go for macrocephaly, it's microcephaly, very important. Okay. Now we are going for the congenital rubella. Whenever I am telling congenital rubella, the triad, I remember triad. So what are the triad in that? Microcephaly, patent ductus arteriosus, and cataracts. So what I feel, so the triad, we'll see this is the most severe torch infection among this congenital rubella is the most severe torch infection. Okay, classical triad, we have heart defect, we have we have cataract, we have sensory neural hearing loss. So the triad is problem in the heart, problem in the eye, problem in the ear, eye, heart. This problem triad, and along with the microcephaly is there. So cataract, some patent ductus arteriosus, and sensory neural hearing loss. So these are the triad. So eye, ear, heart, this triad. Okay, important. So there is some very important question that can become. So most common, even though cataract is a triad, what is the most common ocular finding in congenital rubella? That is nothing but salt and pepper retinopathy. Very important. Salt and pepper retinopathy is the most common ocular finding seen in congenital rubella. And late onset, we have these these babies have late onset diabetes, hypothyroidism, PRP, whatever, etc. And prevention, vaccination through adolescent girls, we have to vaccinate it. Okay, so here the triad, eye, ear, heart, and there is microcephaly. Here microcephaly is important, and salt and pepper retinopathy is the most common ocular finding. This is important in congenital rubella. Okay, so congenital varicella, congenital rubella, microcephaly. Okay, now going to the next one, congenital cytomegalovirus. Last 2 years onwards, NEET is asking the same topic. 2 years back they asked, before that they asked, and highly important. And you can see some MRI image, some CT MRI image here, radiological image. You can see something here. See, what is this? This is nothing but our ventricles. So ventricles. So we can say we'll come to that. So cytomegalovirus, congenital cytomegalovirus infection. This is the most common torch infection. The most severe one was congenital rubella. Most common is CMV, cytomegalovirus. Okay, so here 90% of the infants affected are asymptomatic. Okay, and here sensory neural hearing loss is there, chorioretinitis is there, and microcephaly is there. Okay, so brain imaging, we can see periventricular calcification. That is very important. Around the ventricle, you can see the white color calcification, periventricular calcification. Okay, and we have to do the investigation of the choice is polymerase chain reaction. Here urine is taken more than blood, you can see. Okay, so and it should be done within 2 weeks of birth also. The urine PCR is suggested here more. Okay, so treatment is ganciclovir. So you can see classical periventricular calcification, you can see, and urine is selected, urine PCR is selected more. This is the most common, and sensory neural hearing loss and microcephaly is there. Okay, very important. Okay, very important. And now congenital toxoplasmosis, toxoplasma torchica T. So here also sensory neural hearing loss, chorioretinitis, and microcephaly, similar to previous one. And few infants have hydrocephalus also. Okay, and here the classical feature is diffuse parenchymal calcification. Here the calcification will be diffuse parenchyma. You can see the brain parenchyma. It is diffuse. It is here. It is here. It is here. This is diffuse parenchymal calcification, which is the radiological sign in congenital toxoplasmosis. So congenital toxoplasmosis, diffused parenchymal calcification. Clear? And one more new thing is congenital Zika, which is an emerging infection. Here also microcephaly and visual defects are there, macular scars are there, and here subcortical calcification. Here what we can say, subcortical calcification. You see, this is the cortex, this is the subcortex. Subcortex calcification is seen in congenital Zika. So congenital Zika, so come to the summary, which is very important. They may ask this directly or matching. Congenital Zika, subcortical calcification. Toxoplasmosis, it is diffused parenchymal calcification. Okay. Now when it comes to congenital CMV, around the ventricle, periventricular calcifications are there. And these congenital rubella triad and salt and pepper retinopathy, which are very important, and varicella, everything is important. Okay, so everywhere microcephaly, no macrocephaly. The option mate will be there. Don't go click on that option and don't lose your 4 mark. No, you are going to lose your 5 mark. Please don't. Now come to some spotters. These are lines in dermatology. So you can see it's a lines in dermatology. See Langer's line and Blaschko's line. Simply they'll put line and they'll ask, and you will get 4 mark in your pocket. So what are Langer's line? These are the skin tension line. These are the skin tension line. Incision along this create cosmetically better scar. So these are the skin tension line. So it is cosmetical surgery. There is preference. So if you put incision along that, it is give a cosmetically better scar. So this see the pattern. See how it is there. See it is world. This is very important. Langer's line. Langer's line. Clear? Next is Blaschko's line. These are the development, whenever lines of normal skin development, these are development related lines. So this is very important. Incognitia pigmentae, X-linked dominant. So condition distributed along these include incognitia pigmentae. This disease is along with Blaschko's line. See Blaschko's line. See Blaschko's line is like this. See here more spiral. See here it is like that. So this is very important. His scalp you can see here. Scalp you can see like this. These are Blaschko's line. I will tell like Blaschko like this. Blaschko. Why? Blaschko. And Langer's line. So cosmetically better. So this is very important. Lines in dermatology. Clear? Now see, I gave some babies a beautiful picture. Maybe spotters. It will come to your exam like this. See, fetal alcohol syndrome and the fetal Hydrocephalus syndrome, which is caused by phenytoin. Fetal Hydrocephalus syndrome. See, very simple. They will give a features, and one they will mention in some question. Mother is addicted or something, and baby is having small eye opening, smooth philtrum, thin upper lip. See, these are the features of fetal alcohol syndrome. So epicanthal folds, thin upper lips, the smooth philtrum, and micrognathia, jaw is small, like that. These features are going to fetal alcohol syndrome. Clear? Just I'm going little fast, okay? And see one more, fetal Hydrocephalus syndrome because of phenytoin. So tiny head, microcephaly, tiny nails, digital hypoplasia. The digits are become small, okay, and tiny head, microcephaly, and tiny body because of growth restriction, and they have facial defects like cleft lip, cleft palate also. So this is a classical of phenytoin, phenytiny fetal Hydrocephalus syndrome, which is very important. Classical, you can see the classical image, okay, here. So the symptoms: growth deficiency, development delay, whatever, etc., limb defect, and craniofacial abnormalities will be there. And diagnosis, it is important. Prevention, avoidance of phenytoin during pregnancy, and the treatment, etc., it is given here. At least this is a spotter. Identify with the whatever they are giving lines and words and the image, okay. Here phenytoin may the digit is there, no, this digital hypoplasia, it will come small, okay, it comes small. And here microcephaly is there, everything. And fetal alcohol, smooth philtrum and micrognathia, and you can see like alcoholic face like that, baby. I don't know, I'm telling just like this, okay. This is also very important spotter. So now next we are going to the next spotters. It is already I've written here. This is Dandy-Walker malformation and aqueductal stenosis. So you can see the cerebral aqueduct, it is stenosed here. So it is stenosed here. And you know there is something here. See, something big here. This and all are very important. You know, CSF is prepared in the body from somewhere. You study that pathway. I don't want to teach it again. So whenever there is an obstruction or problem, it will cause something called congenital hydrocephalus. So CSF will accumulate. This fluid will cause problem. So you can see the major causes of congenital hydrocephalus. Congenital hydrocephalus is mainly aqueductal stenosis and the Dandy-Walker malformation. So the stenosis in the aqueductus of Silis, whatever you study. So obstruction located between the third and fourth ventricle, cerebral aqueduct or aqueduct of Sylvis. See, this is the most common cause of congenital hydrocephalus, is nothing but aqueductal stenosis. And imaging finding, you can see here, there is a clear cut stenosis here. Okay. And next one is Dandy-Walker malformation. See X-ray, you can see something big here. So this dilated posterior fossa leads to a prominent occiput. Occiput will be prominent here, and obstruction type, it's lower part of the fourth ventricle obstructed. Okay, so cerebellar hypoplasia, because of this big one is growing, it will compress the cerebellum, and cerebellum is hypoplastic, becomes chota. Okay. So what is the management of congenital hydrocephalus? Nothing but the shunt, ventriculoperitoneal shunt and all. Okay, so this is very important. Aqueductal stenosis and the Dandy-Walker malformation. The most common is between the third and fourth ventricle is the aqueductal stenosis. This is also spotter, which can be asked. And the clinical features of hydrocephalus, what is sun appearance, port resonance, many things are there. Please study that also, but these are the very important things that can be asked. And the synthesis and the clearance pathway and the ventricles where through what foramen it will go, like that is also is there. Nowadays they are not asking that anatomy parts, but sometimes in anatomy you can study that also. Okay, clear. So now what is this person? This is a very famous Shakir's tape. So whenever Shakir's tape is there, no, they will definitely ask the SAM. See, SAM, what is severe acute malnutrition criteria also. So now you see the Shakir's tape. So you can see it is in centimeter. You can see 6, 7, 8 till 11.5 till 11.5. It is in red color. Okay. Then later it is in yellow color here. 11.5 to 12.5. Sorry, yellow. It is not visible. And later you can see something in green color. After 11.5, 12.5. Okay, so green is safe, yellow is little risky, red is dangerous. That is nothing but SAM. So SAM criteria is any one of the following criteria. So weight by height should be less than -3 standard deviation. So you know what is acute malnutrition, chronic malnutrition. In acute malnutrition, what happen? Weight is a problem. Chronic means stunting, height is a problem. That is also very important. You should know. Chronic malnutrition, height to the age is very important. Stunting will happen. Acute may what happen? Acute malnutrition, deficiency of the nutrient, so weight will come down. Weight is the problem. So here weight by height less than -3 standard deviation, and here because of severe acute malnutrition there will be deficiency of protein, hypoproteinemia. With this hypoproteinemia cause extracellular fluid to come and swelling of this and bilateral pedal edema level. That mechanism, basic mechanism. So bilateral pedal edema, and the mid-arm circumference is which is measured in the Shakir's tape. So it is less than 11.5. It is 11.5 to 12.5 is in baby's malnutrition, but okay, we can manage. More than 12.5 it is safe. Less than 11.5, a single criteria, any one is enough. So weight by height ka -3 standard deviation, bilateral pedal edema is very important, and less than 11.5. This is Shakir tape. This is a spotter. So you can see the red, severe acute malnutrition, yellow, moderate acute malnutrition, green is no malnutrition, it is safe. So this is also very important. So today we are discussing some spotters like Shakir's tapes, SAM criteria, and congenital hydrocephalus. Please study about the features and all, and the extra anatomy things, and that spotters are important. Then fetal alcohol syndrome and fetal phenytoin, that is Hydrocephalus syndrome, and lines in dermatology, which can come easily. You can get a 4 point. Okay, then I discussed about the highly important congenital infections, torch infection, congenital infection, varicella, rubella, triad is important, and congenital CMV. This is already asked, and around the ventricle, periventricular calcification, urine PCR. Okay, and toxoplasma, you can see the diffuse the parenchyma diffusely calcifications are there, and congenital sicca mein subcortical area mein calcifications are there, which is a new emerging infections. Okay, and the highly important topic we discussed is STD kit. And Kandipa, definitely there is question from this topic, STD kit and STD, sexually transmitted diseases. Especially please see this page, put into your 20th notebook. This will fetch you 1 or 2 question correct. Okay, and please study it properly. If you mix it, what happened, you will make it wrong, and 1 question will change your life. So these are the important topics we discussed today. We had some little extra time because of some extra motivation and all. and we are discussed something. So these are the contents today. So WhatsApp ka link will be given in the description. Please join. I will allow and watch. Put in some 720p high quality. Watch the video and how to watch and all. Please watch in between whenever you are free, exhausted and all. Okay. So today's third day session is ending here. Tomorrow I will come up with highly important some more topics. Okay. Thank you. See you tomorrow.